Good morning, everyone. And I thank Dr. Sood for making me a part of this wonderful IC. High IOP as a cause for blindness has been recognized since almost 150 years. But over the years, we are able to understand the relation between IOP and glaucoma better, but not completely. We are not there as yet. So, what is the current significance? The earlier definition of glaucoma included IOP, but now glaucoma is defined as a progressive optic neuropathy with a characteristic pattern of disc damage. We don't require intraocular pressure to define glaucoma. IOP is just a risk factor and not the disease itself. As was evident in the cases which Dr. Divya showed earlier. There are many studies, many theories have been postulated. But till date, IOP remains the only modifiable risk factor in the treatment of glaucoma. We now know that glaucomatous damage occurs across the IOP spectrum. We are used to boxing patients into normal tension glaucoma, ocular hypertensive, POAG. But we now know that susceptibility of a patient's eye to IOP depends on other factors also. All right? And a patient developing glaucoma at a lower IOP may have factors which increase their susceptibility to damage. But in general, the principle is higher the IOP, higher the chances of developing glaucoma. This is a graph which even Dr. Divya showed. So earlier when population studies were done, the IOP in the population, the mean was 16. Two standard deviations about 16 was 21. And hence the magic number of 21, the earlier the association between glaucoma and IOP was an absolute. Patients with an IOP greater than 21, you have glaucoma and you need treatment. But no longer. We have now realized that, is there a pointer? Pointer here?
I didn't expect you to use the.
I'm doing that, but there is. Okay, now it's there. So we have now realized that the distribution is skewed to the right, which means there are quite a few patients in whom pressures are above 20 and they will never develop glaucoma. So that is what it is. So there is no magic number of 21. Studies still use 21 as a number, but that is for different reasons. In clinical practice, 21 is just be careful. That's what it is. So IOP lowering definitely reduces the risk of progression, and this is the crux of glaucoma management. The fact that IOP reduction is a modifiable risk factor in the pathogenesis and progression of glaucoma has been proved by different studies which had patients across the glaucoma spectrum. Normal tension glaucoma, advanced glaucoma intervention study. In every study, it was proved that yes, if you lower the IOP, the progression, you are able to slow or stop progression. Our current method, to this day, standard clinical practice relies almost exclusively on in-office tonometry. This is far short of ideal, and those who are glaucoma suspects, we probably take IOP once a year. In a glaucoma treated patient, 3 to 4 times a year. And such snapshots of IOP, they miss spikes of IOP, they do not adequately measure responses to therapy, they do not capture IOP fluctuation. So that's a very flawed way, but that's most of the time, that's how we are functioning. Another thing, methods of measuring IOP are assumptions. Each method has its own pros and cons. To this day, along with all its fallacies, Goldman applanation tonometer remains the gold standard in measuring IOP. In special conditions, you may use other methods like say tonopen or rebound, but GAT remains the gold standard for measuring intraocular pressure. Currently, we have other methods where home tonometry with the rebound tonometer is gaining acceptance, particularly in some patients in whom there is progression even after a good control of IOP. And to conclude, what does all this mean for the clinician? It means if you see disc damage, look for IOP. IOP is the first risk factor. The ability to cause glaucoma is different for different people. Do not start treatment based on a single reading. Do not change treatment based on a single reading. IOP reduction helps even if the IOP is low. Continuous IOP monitoring in some patients will be helpful. Thank you for a very patient